And nowadays, I'm hearing a lot about the vaccine for cancer. Even Sudhamurthy talked about the cervical cancer vaccine and all those things. So, do we have vaccine for all cancer or only one or two cancers?
Yeah. So I wish we had vaccines for all cancers, but unfortunately, no. The cancers that can be prevented with vaccine as of now is only cervical cancer.
Okay.
So usually the job of a vaccine is try to prevent cancer in someone before it even happens. That can be done if cancer is secondary to a particular infection. So if we think about liver cancer, certain types of liver cancer can happen because of hepatitis C and hepatitis B, more often hepatitis. So being vaccinated with hepatitis B, which is preventing you from the infection, will in turn keep you safe not only from the infection but also from a cancer that might come from the infection. So hepatitis B is one such example, which actually has been practiced very well. Most patients, right in their infancy, they actually get hepatitis B vaccines. That is preventing them from getting this infection, and in turn also the liver cancer. Similar way, cervical cancer has the correct vaccine to prevent it, and it is being now put into practice in the Indian communities. So we actually used to administer it to girls starting at the age of 11, 12 years in the West, and that is according to the guidelines. It should be started around the age of 12 to 13, under the age of 15 to 16 years.
Got it.
Before girls become sexually active. Because one of the reasons for cervical cancer is these types of viruses that can start off abnormal multiplication of cells in the cervical area and cause cervical cancer. So the best way is to prevent the cervical infection with these viruses by giving immunity against infection with the vaccine. So yes, the vaccine for cervical cancer is a huge push because cervical cancer does make up for a big chunk of cancers in women. And if it is something that can be prevented by 3 simple shots, which is what it is, 3 doses of vaccines that starts off in young women, then it can actually save a huge burden for the parents, patients, as well as the healthcare community.
Got it. Great. Doctor, there are a lot of other questions related to the different type of cancer treatment, like radiotherapy or the nuclear therapy, chemotherapy. Because of the short of time, we will discuss that one in our next videos.
Sure.
Thanks.
Yes.
Thanks for your time.
Thank you for having me. Yes. Thank you.